The present mood amongst GPs is cynical about the benefits or otherwise of the health bill. A wave of dislike for the quality premium, concern about their incomes, worries about their future pensions, a world-weary view of the way the health service is going, and across the various Celtic nations, a feeling that they're either being left behind something they'd like to take part in, or great relief that they don't have to be put into this in the first place.
A motion to get the BMA to support the throwing out of the bill in its entirety was narrowly defeated yesterday. Would your position have been tenable if it hadn't been?
It would have been very difficult for GPs to continue to be involved with commissioning consortia if we had been told to have nothing to do with it. This would have been strange because, of course, the vast majority of GPs in England, even if they do not like what's going on in the health bill, are involved in consortia. Indeed, I am myself, because to do anything else would be foolish. PCTs are collapsing around us. What are we going to do? Walk away from the health service? Let our patients suffer? No, we're not going to do that. So we have to take part. If we'd been forced to walk away, which is what the vote would have done, that would have made the entire function of GPC very difficult to justify, and we would have had to consider our position.
But a motion to support the withdrawal of the bill was passed by 59%. Do you support that?
Yes, I think most GPs would like the bill to go away, and it would be nice if it was withdrawn, rewritten and redrafted. Amending a bill, as we've seen in the government's amendments which were brought out last week, actually is very challenging. It's very difficult to get a reformed bill when actually what you need is to start again. Otherwise you have clauses that are consequent on other clauses. It's very difficult to work out what's happened. It's going to be hard for parliamentarians to work out what's going on. It would be far better if they took the bill away and came back with something better. Indeed, at this particular time of financial difficulty, now seems a very strange moment to bring in an enormous upheaval of the health bill, which the government said they weren't going to do, of course, in their manifestos. And to do this now, when you haven't got any money, when you've got an ageing population, when you actually need to think about how you're going to make the health service work better, seems very perverse.
And yet in your speech you say at a conference that government's support for competition in the NHS spoils a good idea, which suggests that that's the only sticking point for you.
That is one of the worst sticking points, one of the most important, which is that they're so obsessed with competition they can't actually see how you could improve the health service. The only really good bit of the bill is the idea of clinically led commissioning, which we've had before in the health service. It's not new. Fund holding was not a very good idea and a way of doing it, although many GPs took part in fund holding, largely to preserve their practices. And in the more distant past, in family practitioner committee days, of course, GPs were very much involved with the running of the health service. Indeed, many FPCs were chaired by GPs. And there's no reason why that can't work again, and we are almost recreating FPCs. So that's not a bad idea. If we'd been left to have consortia working in order to improve care for patients, that would be fine. So I think it is a good idea, and it has been spoiled by this obsession, this almost religious belief in competition as a solution to everything, which of course we don't believe it is at all. We think it's a nuisance, and it gets in the way of delivering good health care.
What are your members saying then about their feelings about the change in the makeup of commissioning groups?
I think many GPs were quite happy with it being just GPs. The GPC's view was that you actually did need other people in there, certainly public health physicians, and I think many of us are quite comfortable with nurses, particularly practice nurses, being involved. As for consultant colleagues, well, they had to be there anyway. It would have been mad to create pathways without having consultants who are experts in these areas being participant in the process. So I don't think things have changed very much. I know there are quite a few GPs who feel rather sad that we've opened it up to a slightly wider franchise, but actually that should have been the case anyway. And I think where we are now is okay as far as that's concerned. It's everything else that we're worried about.
You feel very passionately about the quality premium. Tell us about that.
The vast majority of GPs think the quality premium is a dreadful idea. It's the concept is so revolting. I can't imagine why anyone thinks it's a good move to pay GPs if they save money for the health service, which means if I cut care for patients and withdraw services, I will be slipped a bun. This is totally unethical. It's a dreadful idea that I can't imagine many patients thinking is a great runner, that GPs should be slipped a bung for cutting the care. And the fact that governments even are considering this idea is something we think is not on, and we are going to have nothing to do with it. We've told them incentives, fine. You want to put money to the health service? If you really want to deal with health inequalities, why don't we give every poor person £5? If you've got all this money to chuck away, let's do that. We think this is a waste of time and unacceptably unethical.
Are the numbers of GPs who are getting involved in commissioning continuing to rise, and does that signify largely a support for the bill?
Just because you do these things doesn't mean you support them. The fact is that 90+% of GPs in England are involved with commissioning because they haven't got any choice. The government is going to compel everybody to do it, so there will be zero choice. It'll be 100%. The fact that there's a growing number, well, of course there is. As consortia come on stream, more and more and more people are going to be doing it. My consortium I'm in Barnet, in North London, has 100% support. Of course it does, because we're all in it together. That doesn't mean we support the bill. That means because we recognise the structures that there are. I might wish to drive on the right. Unfortunately, we all have to drive on the left, even if we don't like it, because that's the way it is. And I think most GPs are world-weary and cynical enough to realise that there's times when you go with the flow and there's times when you kick against it. That is not acceptance of a bill. That's not welcoming the way things are going. It's just saying, well, if it's got to be this way, I'll participate in it.
Some continue to be world-weary and cynical about the role of the GPC. Are you a group of people with self-vested interests?
All GPs have vested interests. Absolutely. I have the most vested interest that anyone can have. My vested interest is what's good for the patients will be good for me, both in personal, economic, operational, and every other kind of way. And in doing better care for patients, I will be doing myself a favour too. The idea that I do myself a favour first and then the patients come second, it won't work like that. Patients can recognise rubbish when they see it and they walk away in droves, and that's certainly not something any GP wants. I am delighted to accept the accusation of vested interest. Yes, I absolutely have one.
Dr. Laurence Buckman, thank you.